The heart monitor flatlined at 9:47 a.m., and the blood didn't stop. It came in waves, dark, pressurized, the kind that doesn't pool but sprays. And it coated the surgeon's gloves, the instrument trays, the sterile drapes that had been carefully arranged 20 minutes earlier when this was still supposed to be a routine gallbladder removal. The chief surgeon was shouting something that didn't make sense. The residents were backing against the walls. The circulating nurse had already hit the emergency call button twice, with no idea what she was calling for. And then a scrub nurse, quiet, 34 years old, someone most of the staff couldn't have named without checking the schedule, moved. Not fast the way people move when they panic. Fast the way people move when they already know exactly what they're looking at. She crossed the room in 4 steps, put her hand on the chief surgeon's shoulder, and said 2 words. Move. Now. He did. Nobody understood why until later. Before we go any further, if you're watching this and you haven't subscribed yet, now is the time. Hit that subscribe button and turn on notifications. Because the stories we tell here don't slow down, they don't soften, and they never end the way you expect. Drop a comment right now and tell me what city or country you're watching from. I want to see exactly how far this story has traveled. And if it hits you the way it hits most people, hit the like button before we're done. All right, let's go back to the beginning. Cedar Hollow, Colorado sits about 60 miles east of Denver in the kind of flat, wide-open terrain that makes the mountains look closer than they are. It's the kind of town that has 1 decent grocery store, 2 high school football teams that hate each other on principle, and a regional medical center that serves 12 surrounding counties because there's nothing else within reasonable driving distance. Hargrove Regional Medical Center wasn't a small hospital. It had 412 beds, a level 2 trauma designation, a cardiac unit that had been renovated 3 years ago with money from a state grant, and a reputation, well earned, according to the administration, for surgical excellence. The chief of surgery had given a quote to the local paper the previous spring, calling Hargrove a place where medicine is practiced at the highest level, full stop. The quote ran with his photo. He kept the clipping. His name was Dr. Marcus Elroy. He was 51 years old, board certified in general and thoracic surgery, had trained at institutions whose names he dropped into conversation the way other people drop weather observations, casually, constantly, in a tone that implied you should already be impressed. He drove a black SUV he parked in a reserved space near the main entrance. He wore his badge clipped to the lapel of his white coat rather than on a lanyard, which was technically against hospital policy, and nobody had ever said anything to him about it. He had a way of walking through the OR corridor that made nurses step slightly to the side, not because they were required to, but because the alternative felt more complicated than it was worth. The staff had opinions about Marcus Elroy. Most of them kept those opinions between themselves and the break room. Claire Navarro had been a scrub nurse at Hargrove for 2 years and 4 months. Before that, she'd spent 8 years in the U.S. Army, the last 5 of those attached to a forward surgical team that operated in environments most of the doctors she now worked beside had only read about in trauma journals. She was 34. She wore her dark hair pulled back tight when she was working and looser the rest of the time. She had a small scar along her left jawline that she'd stopped explaining years ago. She spoke quietly in most situations and didn't fill silence with unnecessary words, which some people found calming and others found unsettling, depending on what they were used to. At Hargrove, she was known as efficient, technically precise, and difficult to read. She got along well with the nurses she worked with regularly. She did not get along especially well or especially badly with most of the physicians. She was professional with all of them, friendly with a few, and said exactly what she needed to say and nothing beyond it. She had never told anyone at Hargrove about the field surgeries. It wasn't something she hid. It was something she'd quietly learned didn't help. The first time she'd mentioned her combat medical background to a supervising physician, he had smiled in the way people smile when they're deciding whether to take something seriously, and then he'd said, "Well, this is a little different from the field, isn't it?" And she had said yes, because the polite answer was always yes, and she'd stopped bringing it up after that. The morning of March 14th started the same way most mornings started. Claire arrived at 6:15, changed into scrubs, checked the board. The first scheduled case was a laparoscopic cholecystectomy, gallbladder removal, routine, the kind of procedure that got done a dozen times a week in an OR, like this one. The patient was a 58-year-old man named Gerald Marsh, a retired school principal from a town 40 minutes north of Cedar Hollow, who'd been dealing with intermittent right-side abdominal pain for 7 months before his primary care physician finally ordered imaging and referred him to surgery. His labs were stable. His vitals were good. His pre-op notes described him as calm and cooperative. Claire had reviewed the imaging the night before out of habit. It was something she did with every case she was assigned. Not because anyone asked her to, but because she liked knowing what she was walking into. Gerald Marsh's abdominal CT was mostly unremarkable. Except for one thing. There was an anomaly in the vascular architecture near the gallbladder bed. A vessel running slightly off the standard course, positioned in a location that wouldn't be immediately visible during a standard laparoscopic approach. It wasn't labeled in the radiology report. The radiologist had noted the gallbladder pathology and moved on, and whoever had reviewed the scan before scheduling hadn't flagged it. It was the kind of thing you'd see if you were looking for it and miss if you weren't. Claire had seen a version of it before. Not in a hospital, in a forward operating base in a tent, with inadequate lighting and instruments that had been sterilized 4 times over because there weren't enough to go around. A soldier with abdominal trauma and a vascular variant that had nearly killed him before she'd understood what she was dealing with. She remembered the look of that vessel, the way it bled when disturbed, the specific catastrophic speed of it. She printed the imaging and brought it to the pre-op area at 7 a.m., 40 minutes before the case was scheduled to start. Dr. Elroy was at the nursing station, reviewing something on a tablet with the kind of focused expression that communicated he was in the middle of something important. Claire waited until he'd set the tablet down, then stepped forward. Dr. Elroy, I had a chance to look at Mr. Marsh's CT last night. There's something in the vascular anatomy I wanted to flag before we start. He didn't look up immediately. He picked up his coffee first. His pre-op imaging was reviewed at scheduling. I think there's a variant vessel near the gallbladder bed that didn't get noted. It's positioned where it could be at risk during dissection if we're not watching for it. He looked at her then. He had the kind of eyes that evaluated rather than listened. You're a scrub nurse. Yes. And you're telling me you reviewed a patient's CT scan and identified a vascular anomaly that the radiologist and the surgical team missed. She kept her voice level. I'm saying I noticed something that I'd like you to look at. I'm not telling you what to do with it. He took the printout from her. He looked at it for approximately 4 seconds, then handed it back. That's normal anatomical variation. It's within the standard operative field. I've done over 1,000 of these cases. I understand. I thought it was worth mentioning. I appreciate your thoroughness. His tone didn't indicate that he appreciated it at all. Stay focused on your role today. She said, Yes, doctor. She walked back to the scrub sink and started her prep. One of the OR techs, a young woman named Priya, who had been at Hargrove for 8 months and watched everything with very careful attention, came to stand next to her. What happened? Priya asked, her voice low. I mentioned something about the imaging. He disagreed. Are you worried? Claire ran water over her hands and didn't answer immediately. Then she said, I hope I'm wrong. Priya looked at her for a moment and then went back to arranging the instrument trays. Gerald Marsh came into the operating room at 7:52, warm blanket over his chest, a disposable surgical cap over his thinning gray hair. I was the kind of patient who tried to joke when he was nervous. He said something to the anesthesiologist about hoping they had good coffee nearby for the recovery room. And Claire caught herself responding to him in a way she normally didn't let herself respond to patients in pre-op, just a small smile, nothing that would show above her mask once she had it on. Dr. Elroy arrived at 7:57. He had 2 residents with him, Dr. Preston Yates, a second year who moved quickly and talked even quicker, and Dr. Amara Osei, a third year who was quieter and watched things with the kind of attention that usually indicated intelligence or anxiety. And in Amara's case, Claire suspected it was both. Elroy spoke briefly with the anesthesiologist, Dr. Linda Foss, about the anesthetic plan, then moved to the scrub sink without looking at anyone else in the room. The case began at 8:14. Laparoscopic cholecystectomies follow a rhythm that becomes nearly automatic for experienced surgical teams: camera insertion, trocar placement, visualization, dissection of the hepatocystic triangle, clipping and dividing the cystic duct and artery, extraction of the gallbladder. When everything goes correctly, the whole thing takes 45 minutes to an hour, and the patient goes home the next day. The OR has a specific kind of quiet during these cases. The sound of instruments and suction, and the low background noise of ventilator and monitor, with the surgeon narrating occasionally for the benefit of the residents. For the first 20 minutes, everything tracked normally. Claire stood at her position, passing instruments with the efficiency that came from years of repetition, watching the monitor that displayed the laparoscopic camera feed. She kept her attention split between the instrument table and the screen. Dr. Elroy was competent. She had never questioned that. And whatever she thought about his personality, she'd watched him operate enough to know that his technical skill was real. He worked cleanly. He minimized unnecessary movement. He explained what he was doing to the residents in the flat, instructional cadence of someone who had done this too many times to find it interesting. Then the dissection approached the hepatocystic triangle, and Claire saw it. On the camera feed, at the edge of the surgical field, the tissue was arranged in a way that matched exactly what she'd seen in the CT. The vessel she'd flagged, the one that ran slightly off the expected course, was there, partially obscured by a fold of tissue that Elroy was currently working around without appearing to see it. She said quietly, "Dr. Elroy." He didn't respond. "Dr. Elroy, the vessel." He looked up from the monitor toward her with an expression that was less curiosity than irritation. "We're in the middle of dissection." "I know. I think the vessel I mentioned this morning is in the lateral margin of your current field, about 1 centimeter from where your scissors are." Preston Yates looked at the monitor, then at Claire, then at Elroy, the way residents look when they're trying to figure out which way something is going to fall. Elroy said, "I see my field clearly. I understand. Nurse Navarro." He set down his instrument for 2 seconds, which was more unsettling than if he'd kept going, because it meant he was fully choosing to stop and address her. "I told you this morning, that's normal anatomical variation. I have a clear view of the operative field. If you continue interrupting a sterile procedure without clinical basis, I will have you removed from this room. Are we clear?" The room was very quiet. Claire said, "Yes, doctor." She went back to her instruments. Amara Osei, standing on the other side of the table, did not look at anything except the floor for approximately 10 seconds. Elroy picked up his instrument and returned to dissection. Claire watched the monitor. She kept her hands still on the tray, ready. She told herself she was wrong. She ran through it again. The CT image, what she'd seen, whether her interpretation could have been off. She had been wrong before. Everyone had been wrong before. She had flagged things in the field that turned out to be nothing. And she had learned not to let the fear of being wrong stop her from speaking. But she had also learned that speaking and being listened to were different problems. She watched the monitor. Elroy's scissor tips moved into the lateral margin of the field. The bleeding started 9 seconds later. It wasn't the slow seep that surgeons manage every day. It wasn't the kind of bleeding that gets addressed with a bovie and a moment's pause. It was arterial, immediate, high pressure, the camera feed going red within seconds as blood obscured the laparoscopic view entirely. The suction couldn't keep pace with it. The monitor showed almost nothing. "Suction!" Elroy's voice changed registers. The flat instructional tone was gone, replaced by something tighter. "More suction. I can't see anything." Linda Foss, at the anesthesia station, said quietly but clearly, "Pressure is dropping. Systolic 86. "I need visualization." Elroy's hands were moving, but he didn't have a clear field to move into. "Do you want me to convert?" Yates asked. Converting to open surgery, abandoning the laparoscopic approach and going in directly, was not a decision that got made casually, but everyone in the room understood what that much bleeding meant in terms of time. "Not yet. I can't see where it's coming from." "Systolic 79, Linda said. She was pulling medications, her voice controlled in the way anesthesia voices get controlled when things are moving quickly. "I'm pushing volume. Marcus, we're going to need a decision soon." "I'm working." Priya had already moved to the wall cabinet where the vascular clamps were stored. She hadn't been asked. She had just done it, which meant she'd been watching, and she'd started anticipating before most people in the room understood what was happening. Claire met her eyes across the room, and Priya passed the clamps to her without a word exchanged. Claire had them in her hand when the monitor alarm started. Gerald Marsh's heart rhythm, which had been holding stable through the blood pressure drop, changed. The trace on the cardiac monitor shifted into a pattern that the room recognized immediately, the way everyone in a surgical suite learns to read those sounds whether they're trained to or not. VFib, Linda said. He's in VFib, starting compressions. He cannot arrest on this table, Elroy said, and his voice had gone somewhere else entirely. The authority in it had fractured. What replaced it wasn't fear exactly. It was something more specific, the sound of someone whose template for how a situation should go had just stopped working and hadn't been replaced with anything yet. Preston Yates had both hands on Gerald Marsh's chest. He was doing compressions. Linda was working the defibrillator and calling out medication orders to the circulating nurse. Amara Osei had stepped back from the table, not abandoning her position, but caught in that moment of paralysis that hits even experienced residents when the situation outpaces the training, when the scenario becomes real in a way that no simulation quite prepares you for. Elroy had his hands in the field, but he couldn't find the source. I can't visualize. The bleeding is systolic undetectable. He's in arrest, Linda said. I know he's in arrest. Elroy's voice cracked on the last word, almost imperceptibly, but the room heard it. Claire had been standing at her tray with the vascular clamps in her hand for 45 seconds. She had been watching the monitor. She had been watching Elroy's hands and tracking the position of the instruments and calculating, from the position of the initial bleed and the camera angle in the last clear frames before the field went red, exactly where the vessel had torn and exactly how it was angled and exactly what approach would reach it. She wasn't thinking about what happened next in terms of permission. She stopped thinking about it in terms of protocol. Those were frameworks that existed in normal circumstances, and this was not a normal circumstance. This was a man dying on a table at 8:47 in the morning in Cedar Hollow, Colorado, and the person responsible for keeping him alive had lost the field and was running out of moves. She came around the end of the instrument table. Dr. Elroy. He didn't respond. He was still working, still searching, his movements becoming less precise as the urgency climbed. Dr. Elroy. She was at his shoulder now. You need to step back. He turned. The look on his face was something she'd seen before, not in operating rooms, but in other places, on other people. In the specific moment when a situation has exceeded a person's internal map and their expression goes blank in a particular way that means they're not fully choosing what they do next. Excuse me? I know where the vessel is. She kept her voice even, not loud, not demanding, just flat and clear and direct. I need you to step back and let me reach it. The room had gone strange and quiet under the noise of the alarms and the compressions. Everyone was watching. Linda Foss had paused with her hand on the defibrillator. Priya had one hand on the suction tube and wasn't moving. Elroy said, You are a scrub nurse. I know where the vessel is, she said again. And you don't, and he has about 90 seconds. Something happened in Marcus Elroy's face in that moment that she didn't have time to interpret and didn't try to. He took one step back. She moved into the field. Her right hand went in without the camera, without any visualization at all, working entirely from tactile memory and the spatial calculation she'd been running since the field went red. It was the thing she'd learned in the field that no textbook had ever quite described. The way your hands learn to read tissue, the way eyes read a page, the way fingers in a bleeding operative cavity develop their own form of sight. She'd done it in a tent with inadequate lighting while a medevac helicopter made its approach, and 2 other soldiers waited their turns. She'd done it 3 times after that in conditions she didn't think about in comfortable settings. She found the vessel in 8 seconds. It was exactly where she'd expected it. The tear was 1.5 centimeters long, the kind of injury that is catastrophic in a laparoscopic field, but manageable, barely, under the right hands, with direct pressure and the right clamp placement. She got the first clamp on in a position that arrested the major flow without occluding the vessels that needed to remain patent. The bleeding slowed. It didn't stop. There was a second site, smaller, a branch she hadn't anticipated from the CT, and she found that one by field 12 seconds after the first, positioned the second clamp, and held. Linda, she said. Pressure? A pause. 3 seconds that lasted longer than 3 seconds. Systolic 52, climbing. Another pause. 61. Preston Yates kept doing compressions. The rhythm on the monitor was still wrong, but it was the wrong rhythm of a heart that still had something to work with rather than nothing. 74, Linda said, and her voice had changed. 74 systolic and climbing. He's rhythm is converting. The cardiac monitor found a pattern. Not perfect, not clean, but something. Sinus rhythm, Linda said. Marcus, he's back in sinus. The room exhaled. Claire did not move her hands. She kept both clamps exactly where they were, and she said, without turning her head, I need a vascular surgeon in this room in the next 10 minutes, and I need whoever isn't busy to pack the field. Nobody asked her if she had the authority to say that. The call for vascular surgery went out at 8:51. Dr. Kwame Asante, Hargrove's senior vascular surgeon, was already on the floor. He'd been between cases, reviewing imaging for his next scheduled procedure, and he arrived in the OR at 9:03 with his own resident and the expression of a man who has spent enough years in operating rooms to read a situation in 10 seconds flat. He took one look at the field, one look at Claire's hands, one look at the monitors. He didn't ask what happened, not right then. He said, Good placement. Can you hold position while I scrub? Yes, she said. She held for 7 more minutes while Asante scrubbed and gowned. She didn't move, didn't shift, kept steady pressure on both clamps with the particular controlled stillness she'd developed over years of understanding that in a surgical field, stillness was its own form of active intervention. Asante took over the repair at 9:11. It was meticulous, difficult work. The vessel anatomy was as anomalous as Claire had described in pre-op, and Asante noted twice during the repair that the location was unusual, that he understood now why the initial dissection had encountered it unexpectedly, that it was the kind of variant that required specific attention at imaging review. He said these things without emphasis, in the same flat professional tone surgeons use when they're thinking out loud, but everyone in the room heard them. Gerald Marsh's pressure stabilized fully at 9:28. His heart held rhythm. His labs, when they came back 40 minutes later, showed the picture of someone who had sustained significant blood loss and been brought back. Not clean, not without consequences to manage, but alive, stable, recoverable. Claire stepped back from the table when Asante had the repair well underway. She pulled off her outer gloves. Her hands were steady. They were almost always steady now. It had taken years to get them that way, and she hadn't always understood what that kind of steadiness cost, but she understood it now. She was standing at the instrument table doing inventory by muscle memory when Priya came to stand next to her. Priya said very quietly, How did you know? Claire looked at the monitor. Gerald Marsh's vital signs, the numbers climbing towards something that would let him see his family again. She thought about the right answer to that question. She thought about the true answer, which was longer and more complicated and involved a sequence of years and places and decisions that she'd stopped trying to explain to people who hadn't been in them. She said, I've seen it before. Priya looked at her for a moment. Then she nodded and went back to what she was doing. At 11:14 that morning, while Gerald Marsh was being transferred to the ICU and the surgical team was completing documentation, the sound reached the OR corridor before anything else did. It was a particular kind of rotor noise, 2 aircraft, heavy, the specific acoustic signature of military transport helicopters, rather than the lighter medevac units Hargrove occasionally received. The hospital's helipad was on the roof of the east wing, and sound carried through the ventilation shafts in ways that could be disorienting, but several people on the surgical floor stopped what they were doing and listened. Claire was in the locker room, changing out of her OR scrubs. She heard it. She stopped moving for a moment, the way you stop when something is familiar but displaced. The way you hear a sound that belongs to a different version of your life, and have to spend a second locating which version it came from. She pulled on her regular scrubs and went back into the corridor. The word moved through the floor in the way hospital information always moves, fragment by fragment, person to person, imprecise and accelerating. Something about a medical emergency. Something about an army unit. Something about personnel being transported from a training incident that had gone wrong at the National Guard facility 40 miles east of Cedar Hollow. Claire went to the window at the end of the corridor, the one that looked east over the hospital's lower roofline. She could see the helipad from there. 2 Blackhawks were setting down, rotors still turning, the way they set down when whatever they were carrying wasn't going to wait for a full shutdown. The doors opened. Medical personnel moved out first, then stretchers, and then other personnel. uniformed, moving with the particular economy of motion that belongs to people who have operated in high-tempo environments and carry that tempo with them even in a hospital corridor. Claire watched. She recognized the unit patches from 30 feet away, even through the window glass, even at that distance, because there are some things that print themselves on you at a level below conscious recognition and stay there. She was still standing at the window when the corridor doors at the far end opened and the first of them came through. He was a captain, tall, mid-30s, the kind of bearing that was so natural it didn't look performed. He was talking to one of the Hargrove administrators who had materialized to manage the arrival, and his eyes were moving through the corridor the way people's eyes move when they're assessing an unfamiliar environment for exits, obstructions, and personnel. His eyes found her. He stopped talking. He said something to the administrator, something brief, a sentence, and then he turned fully toward her and walked the length of the corridor. Claire didn't move from the window. He stopped 4 feet from her. He looked at her the way people look at you when they're checking their own certainty before they commit to it. And then whatever check he'd been running returned its result, and his posture changed in a way that was subtle and unmistakable to anyone who knew what it meant. He came to attention. He saluted. "Ma'am," he said, "Sergeant First Class Navarro." The administrator, who had followed him, looked between them with the expression of someone who has just walked into a conversation that is operating in a language they don't fully speak. 2 of the nurses who had been in the OR that morning were standing at the far end of the corridor. They had heard the helicopter. They had come to see. They were watching now. Claire returned the salute. "Old habit. Some things you don't forget how to do." "Captain," she said. He was looking at her with something that wasn't quite recognition and wasn't quite disbelief. It was the expression of a person who has just discovered that 2 separate contexts of their life have collapsed into the same corridor and is working out what that means. "What are you doing here, sir?" he asked. "I work here," she said. He looked at the scrubs, the badge clipped to her chest that said Navarro C, scrub nurse. He looked at it for a moment, and then he looked back at her face. "Since when?" he said. 2 years, she said. "A little more." The administrator said uncertainly, Did you serve together?" The captain didn't answer him immediately. He kept his eyes on Claire with the expression of someone who is adding things up. Then he said, "Sergeant First Class Navarro led my medical team in 2 overseas deployments. She is the most capable trauma operator I have personally served with." The administrator blinked. "She also," the captain continued in a tone that had gone quieter and more specific, "performed a field repair on my team's medic using a technique I have never seen replicated in a clinical setting. Under fire, without power, without adequate visualization, with one functioning light source." The corridor had gone very quiet. Claire said, "Captain, you have patience." "I do," he said. He didn't move immediately. "Are you all right?" It was a direct question, and it carried the specific weight of someone who is asking it in a context that the question carries freight, where all right means more than fine, means something about the situation she was standing in this corridor, in these scrubs, with that badge. She said, "I'm fine." He held her gaze for 2 seconds. Then he nodded once, turned, and went back to his personnel. Claire turned back to the window. The rotors on the closer Blackhawk were spinning down now, the sound dropping in pitch through the glass. From 20 feet down the corridor, she heard one of the nurses say to the other, in a voice that was low, but not quite low enough, "Who is she?" And the other nurse, who had been in the OR that morning, who had been standing at the cabinet passing vascular clamps to Priya, who had watched what happened at that table, she said, "I have no idea. But I think we've been working next to her for 2 years, and we didn't know." Claire didn't turn around. She watched the rotors slow, and finally stop. And somewhere below her, in the ICU on the 3rd floor, Gerald Marsh's monitor showed his heart moving in steady rhythm, holding, imperfect, damaged, working. And the numbers climb the way numbers climb when something that was almost lost has found its way back. The rotors stopped, and the corridor didn't go back to normal. That was the thing nobody said out loud, but everyone felt. The particular quality of silence that settles into a space after something has shifted in it. The way a room feels different after furniture has been moved, even once the furniture is back where it started. Hargrove Regional's surgical floor had a rhythm to it. a pace that the staff maintained through habit and necessity, patients moving through pre-op to OR to recovery to floor beds in a sequence that didn't pause for much. But the sequence had paused today, and now the people who kept it moving were standing in a corridor with different information than they'd had at 7 in the morning, and they were quietly trying to work out what to do with it. Claire walked back toward the nursing station. She had documentation to complete: instrument count reconciliation, intraoperative event notes, the chain of custody records for everything that had gone into that OR and come out of it. She sat down at the terminal and pulled up the case file and started typing. Priya sat down next to her 3 minutes later. She didn't say anything immediately. She pulled up her own terminal and started her own notes. After a few minutes of the two of them typing in parallel, Priya said, without looking away from her screen, "The captain knew your rank." "Yes," Claire said. "Sergeant first class." "Yes." Another pause. Priya typed something. Then, "That's not entry level." "No," Claire said. "It's not." Priya nodded slowly, the way someone nods when they're not really responding to what you said, but to what it means. She went back to her documentation. Claire went back to hers. The nursing station around them picked up its usual noise again: phone calls, monitor alerts from the adjacent units, the low background conversation of a floor running at capacity. And inside that noise, the morning sat between them like something neither of them had the right words for yet. It was 11:47 when Dr. Marcus Elroy appeared. He came from the direction of the administrative wing, not the OR corridor, which meant he'd been somewhere other than post-op paperwork for the last 2 hours. And whatever he'd been doing there had arranged his face into an expression Claire hadn't seen on him before. Not the authority he usually wore. Not the particular brand of confidence that functioned more like armor than like actual confidence. What he wore now was something stripped down and harder to read. The expression of a man who has been in a room with people above his pay grade and has come out of it knowing that a version of his life he'd been living has been interrupted. He stopped at the nursing station. He looked at Claire. He said, "My office. Now." She saved her documentation, pushed back her chair, and followed him. His office was at the end of the surgical wing, a corner room with a window that faced the parking structure rather than the mountains, which Claire had always thought was an interesting choice for a man who seemed to care about signaling his own importance. The desk was large. There were framed diplomas on one wall, a dry erase board on another with the week's OR schedule. He closed the door behind them and stood with his back to it for a moment before he moved to his desk. He didn't sit. He said, "I want to be very clear about what happened this morning." Claire stood in the middle of the room and waited. "What you did, entering the operative field without being directed to, taking a position at the table during an active surgical emergency, that is a serious breach of protocol, regardless of the outcome." She said, "I understand." "Do you?" It wasn't a question, because the outcome could have been very different. If you'd been wrong about the clamp position, if your assessment of the vascular anatomy had been inaccurate, you could have killed him. "I could have," she said. "Yes." Something in her agreeing with him seemed to make the next part of his argument harder to locate. He shifted his weight. "The hospital's legal team is already reviewing the intraoperative documentation. There are liability questions that are significant." "I imagine there are." "I'm placing you on administrative leave pending that review." She looked at him. She kept her expression where it usually was. Not blank exactly, but not readable. She'd learned that too, the way faces become a form of resource management when you spend enough years in environments where showing too much of what you're thinking costs you something. "How long?" she said. "Indefinitely, until the review is complete." He picked up a folder from his desk and held it without opening it, the way people hold things when they want to look like they're referring to something authoritative. "I'd like you to submit a written statement about your actions this morning before you leave the building. HR will follow up." She said, "Okay." He seemed to have expected something else. The okays of people who've just been suspended don't usually land that cleanly. His eyes moved over her face, looking for the version of this he'd prepared for. "You don't have anything to say?" She thought about that for a moment. She thought about Gerald Marsh in the ICU, with his heart doing the work it was supposed to do because she'd been in that room this morning. She thought about the CT scan she'd printed the night before and handed to this man and been handed back. She thought about the 8 seconds it had taken her to find the vessel in a field with no visualization, And the 2 hours after that she'd spent at a nursing station doing her documentation while this man was in the administrative wing having a different kind of conversation. She said, "I hope Mr. Marsh recovers fully." Elroy stared at her. "I'll submit the statement before I leave," she said, and she turned and walked out of his office. The written statement took her 40 minutes. She sat in the break room with a cup of coffee that had gone cold and wrote in the plain, factual language she'd learned in the Army, where documentation existed to survive scrutiny, and anything that couldn't survive scrutiny shouldn't be in the document. She described the pre-op imaging review. She described the conversation with Dr. Elroy at the nursing station. She described the intraoperative course of events in sequence, with timestamps where she had them. She described the clamp placement and the clinical reasoning behind it. She did not use words like fortunately or luckily or any language that suggested the outcome had been accidental. She described what she'd done, why she'd done it, and what had happened as a result. She printed 2 copies, submitted one to HR, and kept one. Priya was in the break room when she came back for her bag. She was eating a sandwich she didn't appear to be tasting, her eyes on the middle distance. "He suspended you," Priya said. It wasn't a question. "Administrative leave," Claire said. "Pending review." Priya put down the sandwich. Claire, that's insane. You saved that man's life." "I know." "You were right this morning. You told him. You told him before the case even started, and he—" She stopped, picked the sandwich back up, set it down again. Is anyone else saying anything about this?" "I don't know what anyone else is saying," Claire said. "I haven't been in the loop for the last 2 hours. Amara was talking to someone in the residence lounge when I walked past. She stopped when she saw me." Priya's voice was careful. "And Dr. Asante, when he came out of the OR, he asked where you were. He asked specifically. He wanted to know if you were still in the building." Claire absorbed that. Asante had been in the room. He'd seen the clamp placement. I was the most senior person on the floor below the department chief, and he was the kind of surgeon who didn't ask where people were unless he had a reason. "What did you tell him?" she said. "I said you were doing documentation. He said to let him know when you were done." Priya hesitated. "That was an hour ago." Claire looked at her watch. "Is he still on the floor?" "I think he's in post-op." She thought about Asante's face when he'd come into that OR. The quick assessment, the lack of wasted questions, the way he'd looked at the clamp placement and said good placement with the directness of someone who means exactly what they say. She thought about whether it mattered, whether anything that Kwame Asante wanted to say to her would change what was already in motion. She said, "I need to get my bag." Priya looked at her. "Are you going to fight this?" Claire picked up her empty coffee cup and put it in the sink. "I don't know yet," she said, which was true. She found Asante at the post-op unit at 12:30, standing at a chart station reviewing Gerald Marsh's most recent labs. He looked up when she came in. He had the kind of face that was economical with its expressions. He didn't smile, didn't make a gesture of acknowledgement, just looked at her steadily, the way he'd looked at the clamp placement. "You're leaving the building," he said. "Administrative leave," she said. "Elroy." He made a sound that was not quite a word, and not quite not a word. He set the chart down. "Your clamp placement was correct. The first point, the primary tear, you positioned it exactly where I would have placed it with full visualization. The second site was a branch I didn't anticipate from the imaging either, and you found it blind." He said it the way he'd said everything in that OR. Flat, factual, not dressed up. "I want to be clear that I'm documenting this." "Okay," she said. "You should also know that the imaging you flagged this morning, I reviewed it after the case. The vascular variant is visible on the CT if you're looking for it in the right place. The radiology report didn't note it, but it's there." He paused. "I'm adding a note to the case file." She felt something in her chest that wasn't quite gratitude and wasn't quite relief. It was closer to the specific sensation of having been correct about something you'd have given a great deal to be wrong about. "Thank you," she said. "I'm also going to want to speak with the department chief," he said. "Not Elroy. Whitmore." Dr. Judith Whitmore was the chief of the medical department, 2 levels above Elroy in the hospital's administrative structure. Claire had seen her at department meetings. She had the reputation of being precise, unhurried, and difficult to misread. "That's your call," Claire said. It's not just my call, Asante said. He looked at her directly. You need to talk to someone in administration before this gets entirely framed by the people who have the most to lose from an accurate account. She thought about the folder Elroy had been holding, the legal team that was already reviewing documentation, the way he'd said liability questions with an emphasis that could mean several different things. I understand what you're saying. Do you have anyone, a rep, a union contact? I'm not in the union. I was going to call a friend tonight. Asante nodded. He picked the chart back up, which meant the conversation was concluding, but before she turned, he said, without looking up, Navarro, what you did in that room this morning, the technique, the execution, I've been in surgical practice for 19 years. I want you to hear that. She heard it. She left. The afternoon was the kind of afternoon that happens after a morning like that one. Gray, too long, full of a specific quality of mental noise that comes from having done something irreversible in a high-stakes environment and now having nothing immediate to do with your hands. Claire drove home, 40 minutes through flat land and sparse traffic, and sat in her apartment for a while without turning on any lights. She called her friend Teresa at 4:15. Teresa Kowalski had been a JAG officer, Army legal, and now worked in medical malpractice litigation in Denver, which was the kind of career pivot that only made sense if you understood how much the two fields overlapped. They'd known each other since Fort Polk, before either of their careers had taken the shapes they'd taken, and Teresa was one of about 4 people Claire trusted to give her the unfiltered version of a situation. She told Teresa what had happened. All of it. The pre-op conversation, the case, the administrative leave, Asante's notes, the captain in the corridor. She told it in sequence without editorializing, the way she'd told the written statement, and when she was done, Teresa was quiet for a moment and then said, Okay, first question. Do you still have a copy of the written statement you submitted? Yes. Second question. Are there other people in that OR who are going to tell the same story you're telling me? Asante. Probably Amara Ose. She's a third-year resident. She was there. Priya. The anesthesiologist, Linda Foss. The attending who suspended you, was he present for the entire operative course? He was in the field when the vessel was severed. He was present when I intervened. Teresa was quiet again, the way she got quiet when she was organizing information rather than processing emotion. Claire, what you're describing, if the documentation supports it, which it sounds like it does, this isn't just a disciplinary question. This is a patient safety event, a serious one. And Elroy suspending you within 2 hours of that event, before any formal investigation, is going to look exactly like what it is. What is it? Damage control, Teresa said. His damage control. Claire leaned back in her chair and looked at the ceiling. The apartment was quiet in the way apartments get quiet in the late afternoon when the building's sounds settle into a lower register. He said the legal team was already reviewing documentation. Of course they are. The hospital's exposure on this is significant. But here's the thing. The hospital's exposure decreases if the documentation shows that the clinical outcome was appropriate and that a competent person intervened correctly. Their problem is Elroy, not you. And if they're smart, they're starting to understand that. If, Claire said. If, Teresa agreed. Do you want me to make some calls? She thought about it. She thought about what making calls meant in terms of what it set in motion, what it couldn't be pulled back from once it went. She thought about Elroy's face when she'd walked out of his office. She thought about Gerald Marsh's monitor at 9:28, the numbers climbing. Not tonight, she said. Let me see what the morning looks like. The morning looked like 3 missed calls from a Hargrove HR number she didn't recognize, a voicemail from Asante asking her to call him before 9, and a text from Priya that said only, "You need to know something. Call me." She called Priya first. Priya picked up on the second ring. She sounded like someone who hadn't slept much or well. "Okay," she said immediately. "So, last night after you left, Dr. Whitmore came to the floor. Judith Whitmore, not someone from her office, her personally. She was here until almost 8. She reviewed the OR footage. Apparently the case was recorded as part of the new QA protocol they started in January. Did you know about that?" Claire hadn't known about that. "The whole case is on camera," Priya said. "The whole thing. Your pre-op conversation with Elroy is in the pre-op bay, and that's not recorded, but the OR footage starts from setup. It shows Claire, it shows the whole intraoperative course. Everything. She processed that. The conversation in the pre-op bay wasn't recorded, but everything from the moment the case went active would be. The bleeding. Elroy's inability to visualize. Her coming around the instrument table. The clamps. The timing of everything. "Is Whitmore reviewing it for the legal team?" she said. "I don't know, but when she left, she didn't look like someone who'd just handled a problem. She looked like someone who'd just found a bigger one." Priya paused. "And Elroy wasn't on the floor this morning. He has 2 scheduled cases, and they've both been reassigned." Claire sat very still. Reassigned cases meant pulled from the OR. Being pulled from the OR pending what? An internal review. A conversation with administration. Outside, the morning was clear in the way Colorado mornings get clear after cold nights. The light sharp-edged and the shadows not soft at all. The mountains to the west were fully visible in a way they sometimes weren't, every ridge distinct. "I'll be there in 40 minutes, she said. She ended the call. She stood at the window for a moment longer, not quite thinking and not quite not thinking. The specific state that precedes walking into something you can't preview and can only navigate from inside. She picked up her keys. The Hargrove parking structure was half full at 8 in the morning, and she took the stairs rather than the elevator out of a habit so old she didn't examine it. The walk from the parking structure to the main entrance took her past the east wing, past the row of windows that looked into the ICU on the 3rd floor. She didn't stop, didn't look up, but she was aware of the floor the same way you're aware of things you're not directly attending to. The administrative wing was on the 2nd floor of the main building, past the lobby, through a set of doors that the general public didn't often navigate. The carpet was a different shade from the clinical floors. The lighting was softer. The sounds were different too. No monitors, no overhead pages, just the low ambient noise of offices and the particular quality of quiet that institutional power tends to generate around itself. She gave her name at the administrative reception desk. The receptionist, young, efficient, with the specific posture of someone who manages access to important rooms for a living, made a short phone call, then said, "Dr. Whitmore's assistant will come down." Claire stood and waited. She didn't sit. She had learned years ago that there was a difference between waiting and holding, and she was holding. She heard the voice before she saw the person it belonged to, low, unhurried, coming from the direction of the hallway that ran toward the larger conference rooms. She recognized it the same way she'd recognized the rotor sound the day before. Not immediately, not consciously, but in that layer below deliberate recognition that responds to things your body has cataloged without your permission. She turned. Captain David Reyes came around the corner accompanied by a woman Claire had never met, 50s, in Army service uniform rather than fatigues, a colonel's insignia at her collar, the kind of bearing that indicated she had been a serious person for a very long time. They were mid-conversation, and both of them registered Claire at the same moment, and the captain stopped first. He said, "Navarro." The colonel's eyes moved to Claire with an assessment that was so quick and comprehensive it was almost invisible to anyone who hadn't spent time being assessed by people who did it for a living. The captain said, "Colonel Maris, this is Sergeant First Class Claire Navarro. She's the person I told you about this morning." Colonel Maris looked at Claire for one full second. Then she said, "The one who held the clamps." "Yes, ma'am," the captain said. The colonel extended her hand. Claire shook it. The colonel's grip was exact. The way things are exact when precision is so habitual, it operates without thought. "We were just about to go into a meeting with the hospital's chief of medicine," Colonel Maris said. She said it the way people say things when they're offering you information to see what you do with it. "It seems our visit yesterday intersected with a situation that requires some clarification about your background and qualifications." Claire looked at Reyes. He was watching her with the expression she recognized from the window the day before, the one running its check. "What kind of clarification?" she said. Colonel Maris said, "The kind that apparently the hospital should have had 2 years ago." She let that sit for a moment, then, "Walk with us." And somewhere above them, on the 3rd floor, in the ICU that overlooked the east parking lot, Gerald Marsh opened his eyes for the first time since surgery and asked the nurse standing by his bed if someone could tell him what happened. Because the last thing he remembered was counting backward from 10 on a table, and then nothing. And now here he was. And something in the air of the room told him that whatever came between those 2 moments was a story he was going to need to hear. The conference room was on the second floor, at the end of the administrative hallway, a room with a long oval table and chairs that cost more than most of the nursing staff's monthly take-home. Claire had never been in it. She'd walked past it 100 times on her way to the HR office or the employee health clinic, and she'd registered it the way you register rooms you have no particular reason to enter, as furniture in the background of a building you work in. She entered it now behind Colonel Maris and Captain Reyes, and she took in the room in the same way she took in any room she entered for the first time: exits, positions, who was already seated, and where. Dr. Judith Whitmore sat at the near end of the table. She was in her early 60s, compact, with close-cropped silver hair and reading glasses pushed up on her forehead that she'd clearly forgotten to set down somewhere. She had a legal pad in front of her with handwriting on it that was too small to read from the door. To her left sat a man Claire didn't recognize, mid-40s, in a suit rather than a white coat, with a closed laptop and the look of someone whose job was to be in rooms like this one when things were complicated. Hospital, legal. To Whitmore's right, unexpectedly, sat Dr. Kwame Asante, still in his clinical badge and lanyard, his hands flat on the table in front of him. There was no sign of Marcus Elroy. Whitmore looked up when they came in. Her eyes moved from Colonel Maris to Captain Reyes to Claire, and when they reached Claire, they stayed there for a moment with an expression that wasn't readable in any simple way. Not warm, not cold, but focused in the manner of someone who has been doing a kind of math and has just confirmed one of the variables. "Ms. Navarro," she said. "Sit down, please." Claire sat. Reyes and Colonel Maris took chairs across the table. The man in the suit opened his laptop. Whitmore said, "I'm going to explain what this meeting is and what it isn't, and then I'm going to ask you to bear with a process that I understand may feel inadequate given what happened yesterday." She had a way of speaking that cut directly to the structure of things without running through pleasantries first, which Claire found easier to work with than the alternative. "This is not a disciplinary proceeding. The administrative leave issued by Dr. Elroy yesterday is suspended, effective this morning. That decision was made at my level, not his." The man in the suit looked at his laptop screen and didn't look up. "What this meeting is," Whitmore continued, "is an attempt to establish a factual account of the intraoperative event before any formal investigation proceeds, with the relevant parties present. That includes Dr. Asante as the surgeon who completed the repair, Colonel Maris and Captain Reyes from the Army Medical Command, and you." She set her pen down. "I've reviewed the OR footage." Claire said, "All of it?" "From setup to close." "Yes." The room was quiet for a moment, in the way rooms get quiet when something significant has been said plainly. "Then you know the sequence," Claire said. "I know what the footage shows. I want to hear it from you directly." Whitmore looked at her steadily. "Start from the pre-op conversation." So Claire told it again. The same way she'd told it in the written statement, in the same sequence, in the same factual language. She described the CT finding. She described handing Elroy the printout. She described being handed it back. She told it without editorializing and without the particular emphasis that would have been easy to put in, the kind of emphasis that performs injury, because she had learned that performed injury tends to make people feel they're managing your emotional state rather than receiving information, and she needed them receiving information. When she got to the intraoperative sequence, Asante interrupted once, not to contradict her, but to add a clinical detail about the vessel architecture that she hadn't had the terminology for, and she nodded and incorporated it and kept going. When she described the clamp placement, Colonel Maris asked one question. "Blind approach? No camera feed?" "None," Claire said. "The field was fully obscured." The colonel wrote something on the notepad she'd brought. When Claire finished, the room was quiet again for longer this time. Whitmore looked at the legal pad in front of her and then at Asante. "Does that account align with your observation of the intraoperative course?" "Entirely," Asante said, "with the addition that the clamp placement on the primary tear was precise enough that I made no adjustment when I took over the repair. I worked directly from her position." The man in the suit typed something. Whitmore said, "Colonel Maris, you requested this meeting jointly with the administrative office. I want to give you the floor." Colonel Maris set down her pen. She looked across the table at Claire with the same direct assessment she'd used in the hallway, and then she addressed Whitmore. "Sergeant First Class Navarro served 8 years in the United States Army. the last 5 attached to the 31st Forward Surgical Team in 2 overseas theaters. During that service, she performed or assisted in over 300 trauma procedures under operational conditions. She said the numbers the way she said everything, not for effect, but because they were the accurate numbers, and accurate numbers were what the situation required. She was awarded the Army Commendation Medal for a specific field intervention in which she performed blind vascular control on a critical casualty with penetrating abdominal trauma under active fire without adequate visualization or conventional surgical equipment. The patient survived. A pause. That intervention used the same anatomical approach she used in this operating room 2 days ago. Whitmore said, "She was awarded for it. Yes. And her Army record reflects this. Fully documented." Maris opened the folder she'd brought and slid 2 pages across the table toward Whitmore. "This is a summary of her service record and the commendation documentation. I can provide the full record through official channels within 24 hours if the hospital requires it for its investigation." Whitmore looked at the pages. She looked at them for a long time without speaking, which was its own kind of statement. Then she looked at Claire. "Did you disclose your military background to anyone at Hargrove during your hiring process?" "I disclosed that I had served," Claire said. 8 years, honorable discharge. It's in my HR file. But not the specifics. I was asked if I had a nursing license and current clinical certifications. I do. I answered the questions I was asked. Whitmore held eye contact with her for a moment. Then she wrote something on her legal pad. "Okay," she said. "Here's where we are." Where they were, as Whitmore laid it out, was this. The intraoperative footage had been reviewed by the hospital's quality assurance team the previous evening at Whitmore's direction. The footage documented clearly that Claire had raised the imaging concern in the pre-op bay, not on camera, but her departure from the bay and the printout still visible on the nursing station counter were in the frame. The intraoperative footage showed the course of events in a sequence that could not be misrepresented. Elroy's response to the crisis and Claire's intervention were on record. Additionally, and here Whitmore paused in a way that communicated this was the part that had changed the shape of the morning, the QA team's review had flagged the Marsh case as the 6th intraoperative event in Dr. Elroy's case history in the past 19 months to involve a significant intraoperative complication. The previous 5 had been individually reviewed and individually closed. Viewed as a sequence, they constituted a pattern that the QA process had not identified because no one had looked at them as a sequence. Until last night. The man in the suit had stopped typing and was looking at the table. Dr. Elroy has been informed that he is on administrative suspension pending a formal surgical performance review, Whitmore said. That decision was made this morning by the board, not by my office alone. She looked at Claire. The suspension of your leave is effective immediately. You are cleared to return to your position. Claire said, "Thank you." Whitmore said, "I want to be clear that this meeting is not the end of a process. It's the beginning of one. There will be a formal investigation. There will be documentation requirements, and your participation in that process will be requested. That's going to take time and it's going to be uncomfortable." "I understand." Whitmore studied her. "Is there anything you need from this office in the immediate term?" Claire thought about it. She thought about what she actually needed and whether it was the kind of thing you said in a room like this one to a person like Judith Whitmore. She decided it was. "Mr. Marsh," she said. "Gerald Marsh, I'd like to know how he's doing." Something moved across Whitmore's face. Not quite surprise, not quite not surprise. "He was upgraded from ICU to step-down care this morning," she said. "His family is with him." Claire nodded once. "That's what I needed to know." She walked out of the conference room at 9:47. The hallway was the same as it had been on the way in. The carpet, the softer lighting, the low ambient quiet of offices. But it felt different in the way spaces feel different once you've passed through them in both directions, and the passage has meant something. Reyes fell into step beside her. She didn't say anything, neither did he, for about 30 seconds. Then he said, "You should have told them." "Told them what?" "When you got hired here, your record." She glanced at him. "I answered the questions I was asked." "That's not the same as telling them." "No," she said. "It's not." He walked with her to the elevator. He hit the button and they waited. She could feel him trying to work out whether to say the next thing he was thinking, which she recognized as a particular kind of restraint from a man who was normally direct. "Why didn't you?" he said finally. She thought about the physician who had smiled at her 2 years ago and said, "This is a little different from the field, isn't it?" She thought about all the versions of that smile she'd encountered, in multiple contexts, the way people in established hierarchies process someone who comes in from outside the hierarchy's credentialing system, the way the instinct to classify overrides the instinct to assess. She thought about how much it cost, every time, to explain a background that required the listener to revise their map of who they thought you were. She said, "Because every time I did, it became the thing I had to manage for the other person." Reyes looked at her. The elevator opened. "And you were tired of managing it," he said. "I was tired of managing it." They got in. The doors closed. He looked at the numbers above the door, and she looked at the same numbers. And in the elevator's particular silence, he said, "Colonel Maris wants to talk to you after this settles. Not officially, not about the investigation, about something else." "What kind of something else?" "She'll tell you herself." The elevator stopped at 3. He held the door with one hand. "She's going to be here until tomorrow." She said, "Whenever you're ready." Claire stepped out onto the 3rd floor. She turned back. "Thank you," she said, "for coming back." He looked at her with the expression she'd been reading since yesterday, the one that was still running its check, still adding things up. "You'd have done the same," he said. "She probably would have. She didn't say so." The elevator doors closed. The step-down unit was quieter than the ICU, lower monitoring intensity, the particular atmosphere of a floor that handles patients who have moved from critical to stable, where the urgency has downshifted into the longer work of recovery. Claire had been on this floor enough to know the staff by name, the rhythms of the shift changes, which rooms were visible from the nursing station and which weren't. She stopped at the nursing station and asked about Marcia's room. The charge nurse, a heavy-set man named Terrell, who had a way of tracking everything that happened on his floor from a standing position, told her 312 and then said, "He's been asking about you." She stopped. "He has?" "Not by name. He doesn't know your name." Terrell looked at her with the specific expression of a charge nurse who knows more about what goes on in a hospital than most administrators give him credit for. "He keeps asking one of the nurses to find out who held on and didn't let go." That's how he described it. Whoever held on and didn't let go. She stood there for a moment. "Room 312, Terrell said again, gently this time. She went to 312 and stopped in the doorway. Gerald Marsh was propped up at a slight angle, the elevation that step-down patients get when they're stable enough to be uncomfortable lying fully flat. He was gray in the face in the specific way people are gray when they've lost significant blood and their body is doing the long arithmetic of replacing it. His left hand had an IV in it. His right hand was resting on top of the blanket. There was a woman in the chair to his left, early 60s, dark-haired going silver, with the particular exhaustion of someone who had spent the last day and a half in a waiting room and only recently been allowed to stop waiting. His wife. Had to be. Marcia's eyes were open. He looked at Claire in the doorway with the slow focus of someone whose cognition was mostly back, but whose energy was still rationed. He said, "You." She said, "Me. You're the one who—" He stopped. His throat worked. "The nurse told me a little. Not all of it." She came into the room. She didn't sit. There was only one chair, and the wife was in it. She stood at the foot of his bed where he could see her without turning his head. "You had a complication," she said. "A vessel that wasn't where it was expected to be. It was repaired. You're going to be okay." He looked at her for a long moment. Then he said, "She said you didn't let go." "I held until the vascular surgeon was ready to take over." "That's not what she said." His voice was rough, low. "She said you held on to me. Is that—" He stopped again, cleared his throat. "Is that what happened?" She looked at this man she didn't know, who had come into her OR at 7:52 in a disposable surgical cap, making nervous jokes about coffee, and she said, "Yes, that's what happened." His wife made a sound that wasn't quite a word. She had both hands over her mouth. Marcia's right hand moved on the blanket. Not reaching for anything, just moving, the way hands move when something is too large to hold still through. "Thank you," he said. She stayed for 2 minutes. She didn't tell him about Elroy, or the investigation, or the meeting that had just concluded on the floor below. Those were not his things to carry. She told him that Dr. Asante was an excellent vascular surgeon and that the repair was sound, and that the most important thing now was protein and rest and doing exactly what the step-down nurses told him to do, which were the things that were actually useful for him to hear. When she left room 312, she stood in the hallway for a moment outside the door with her back against the wall and her hands at her sides. She was not entirely steady. She hadn't been entirely steady since yesterday morning, and she'd been managing that unsteadiness the way she managed most things, by giving it no oxygen and staying focused on the next thing in front of her. But there were moments when the management slipped, and this was one of them, brief and inconvenient and entirely private in the way the things that cost you most always are. She stood there for 40 seconds. Then she pushed off the wall and went back to the nursing station to ask Terrell for a requisition form, because she was cleared to return to work, and she had a shift in 6 hours, and there was a pre-op checklist for tomorrow's first case that she was going to review before she left the building. The shift passed the way shifts pass under controlled pressure, busy enough that there wasn't time for the kind of thinking that spirals, slow enough in certain moments to feel very long. The surgical floor had absorbed what had happened the previous day in the way hospital floors absorb things, which is to say, imperfectly and in fragments. Different people carrying different versions of the story with different levels of accuracy. By mid-afternoon, 3 things had happened that Claire learned from the ambient information field of the nursing staff rather than from any official communication. First, Amara Osei had submitted a written account of the operative event to the QA department. She'd done it voluntarily, without being formally asked, which required a particular kind of decision from someone who was still in residency and therefore professionally vulnerable in ways that attendings were not. Claire heard this from Priya, who had heard it from a resident who shared call shifts with Amara. Second, the OR footage had been flagged for preservation by the hospital's legal team. Preservation, not deletion, which was a meaningful directional signal about which way the legal analysis was running. Third, Preston Yates, the second-year resident who had been doing compressions during the arrest, had been seen in the hallway outside Elroy's office at 1 in the afternoon. He had not gone in. He'd stood outside the door for approximately 30 seconds and then walked away. Nobody knew what he'd been going to say. Claire filed all 3 pieces of information and didn't share her analysis of any of them. She was finishing her end-of-shift documentation at 5:40 when her phone buzzed. A number she didn't recognize, Colorado area code. She answered. A woman's voice, brisk and unhurried, said, "Navarro, this is Maris. I told Captain Reyes I'd reach out directly." A pause that felt like she was moving somewhere, the ambient sound of the hospital's lobby changing behind her. "Are you free in the next hour?" "I can be," Claire said. "I'd rather not do this in the hospital. There's a diner on Route 9 about 3 miles east, the lakeside. Do you know it?" "I can find it. 45 minutes. And Maris hung up. Claire looked at the phone for a moment. Then she submitted her documentation, signed out, and drove east on Route 9 as the evening light went low and golden over the flat land, the mountains behind her getting smaller in the rearview mirror and the road ahead running straight through country that didn't give you anything to hide behind. The Lakeside Diner was the kind of place that had been there for decades and showed it. Vinyl booths, a counter with stools, pie rotating under glass at a pace that suggested the pie was serious business. Maris was already there, in a corner booth, out of uniform now, in civilian clothes that she wore with the same bearing she'd worn the service uniform, which was to say they fit differently on her than they would have fit on most people. Claire slid in across from her. A waitress appeared, and they both ordered coffee, and the waitress disappeared. Maris said, "I'm going to tell you something, and I want you to hear all of it before you react." Claire said, "Okay." Army Medical Command is restructuring its forward surgical training program. The current model has gaps, specifically in what we're calling adaptive operative response under degraded conditions, meaning what you do when the equipment fails, when the visualization fails, when the textbook approach is unavailable and the patient is dying anyway. She wrapped both hands around her coffee mug. We've been looking for the right person to design the practical component of that curriculum for 8 months. Someone who's done it operationally, not someone who's theorized about it. Claire looked at her. "Your name came up before yesterday," Maris said. "Reyes has mentioned you twice in the past year. I didn't pursue it because I didn't know where you'd landed after your discharge. And then yesterday we landed here and now I know." She looked at Claire directly. I'm asking if you'd be interested in a conversation about it. Not a commitment, a conversation. The coffee arrived. Claire wrapped her hands around the mug the same way Maris had, because the evening had gone cool and because it was something to do while she sorted through what she was actually feeling about what she'd just been asked. She was almost 35. She had spent 2 years in scrubs in a hospital where she'd been invisible in a specific and particular way, and she had been building a life inside that invisibility that had its own logic, its own rhythm, its own version of sufficiency. She had told herself that was enough. She had told herself that most days. She said, "What does a conversation look like?" "It looks like you coming to Fort Carson next month and sitting in a room with me and the program director and telling us what you think is wrong with the current training model." Maris had a small, precise quality to her that reminded Claire of certain surgeons, the ones who had been doing things long enough to strip away everything that wasn't necessary and were left with just the operating mechanism. "Then we tell you what we're trying to build. Then you decide if you want to be part of building it." Claire thought about Gerald Marsh saying, "You held on to me." She thought about the 8 seconds in the dark red field. She thought about the tent and the inadequate light and the 2 soldiers waiting their turns, and the 3 times after that, and all the times she'd done variations of the same calculation that the textbook said shouldn't be done this way, and she'd done anyway because the alternative was not doing it at all. She thought about what it might mean for that to be something other than a private archive, something transmissible, something that other hands could learn before the catastrophe rather than inside it. She said, "I'll come." Maris nodded. That was all. Just nodded, the nod of someone who had expected the answer and didn't need to perform satisfaction about it. They drank coffee. Outside the diner windows, the Route 9 traffic moved in the last light, headlights beginning to make sense against the dimming sky. Claire was halfway through her cup when her phone buzzed on the table. She looked at it. Priya. She picked it up. "I'm off shift," she said. Priya's voice was different from the tone she used during work hours, stripped of the professional filter, which was how Claire knew immediately that whatever came next wasn't routine. "I know, I'm sorry, something just happened and I thought you should hear it from me before the morning." Claire set down her mug. Across the table, Maris noticed the change in her posture and went still. "What happened?" Claire. "Elroy," Priya said. "He came back to the hospital tonight. I don't know why. His access should have been restricted, but someone didn't update the system or he used his backup credentials. I don't know. He went to the OR wing." A pause. "He pulled Marsh's operative records from the physical chart room. The pre-op imaging, the intraoperative notes, the anesthesia log." Another pause, shorter. "The copy you printed. The CT printout you brought him in pre-op that he handed back to you. He took it." The diner noise continued around Claire. The pie rotating, the counter stools, 2 men laughing at something near the window. And inside that noise, she sat very still and processed what Priya had just told her. The copy she'd printed was the one piece of physical documentation that showed she'd reviewed the imaging independently, that she'd identified the variant, that she'd brought it to Elroy's attention before the incision. Without it, the pre-op record was a conversation that happened in a hallway with no camera on it. Without it, the sequence became harder to establish. Except, she said, "Priya, the QA team, when Whitmore had them review the footage last night, did they pull the imaging records too?" A pause on the other end. "I don't know. I think they pulled everything in the case file." "Digital records," Claire said. "The CT images are in the system. They don't disappear because he took a printout." "But the timestamp on your review is in the system," Claire said. "When I logged into the imaging viewer the night before surgery, that access is logged, with my credentials, the time, and the specific images I opened." She wasn't certain of this. She was reasoning from what she knew about hospital systems, which was incomplete, but it was the right reasoning. "He can take a piece of paper. He can't take a server log." Priya breathed out. "Oh. Tell me exactly what the security staff is doing about it." "That's the other thing," Priya said. "The floor manager called security when she saw him. He left before they got there. But there's camera footage of him in the chart room and it's—" She stopped. Claire, he knew where the camera was. He had his back to it the whole time. Maris was watching her from across the booth with the particular attention of someone who has been in enough serious situations to recognize when one is unfolding in front of them. Claire said, "Who else knows?" "Me, the floor manager, security, and now you." Call Asante, Claire said. Tonight, not tomorrow, right now. Okay. And Priya, don't talk to anyone else until you've talked to him. She ended the call. She set the phone on the table. The diner felt the same as it had 30 seconds ago, and simultaneously like a different place. Maris said, Problem? Claire looked at the window. Headlights on Route 9, moving east and west through the dark in both directions, going somewhere and coming from somewhere, and indifferent to any of it. Elroy broke into the chart room tonight, she said. He took physical documents from the Marsh case file. Maris was quiet for precisely 2 seconds. Then she said, Does he know about the server logs? I don't know what he knows. Another 2 seconds. Does the hospital's legal team know he did this? Not yet. Maris set down her coffee mug and picked up her phone. Maris made 2 calls in the lakeside diner while Claire sat across from her and drank the rest of her coffee and watched the Route 9 traffic move through the dark. The first call lasted 4 minutes. Maris spoke in the clipped, structured way of someone who had learned to transmit information under time pressure and had never entirely stopped doing it. Claire caught enough to understand she was talking to someone in the Army Medical Command's legal division, not asking for advice, relaying facts, establishing a record of the conversation by having it. When she ended that call, she immediately made the second one, shorter, and this one Claire couldn't follow because Maris turned slightly toward the window and her voice dropped below the diner noise. When she put the phone down, she said, The Army has an interest in how this resolves. I want to be transparent about that. What happened in that OR involves a decorated service member and a medical technique that is formally documented in her service record. If that documentation becomes relevant to a legal proceeding, we will make it available. She looked at Claire steadily. That's not intervention, that's due process. Claire said, I understand the distinction. Good. Maris picked up her coffee, found it cold, set it back down. Call your attorney friend tonight, the one in Denver. Claire had already been thinking about Teresa. I will. And get home. Tomorrow is going to be longer than today. She drove back through the Route 9 dark, with the windows cracked because the evening air had the particular quality that high-altitude Colorado evenings get in March, cold and clear, and carrying the faint mineral smell of land that has been frozen most of the winter and is just beginning to remember it won't be forever. She called Teresa from the car on the hands-free and told her about Elroy in the chart room. Teresa listened without interrupting, which was how Claire knew she was taking it seriously. When she finished, Teresa said, Server access logs. You're right about that. They're time-stamped. They're tied to your credentials. They establish you opened those specific images the night before surgery. That's not nothing. That's actually significant. A pause. But I want you to do something tonight, before you sleep. Write down everything you remember about the pre-op conversation with Elroy. Word for word, as close as you can get. Time, location, what you said, what he said, what you were each holding, who was in the vicinity. The more specific, the better. I already put it in the written statement. Write it again, separately. Date it tonight with tonight's date so the timestamp is accurate. Memory degrades. Every additional version you produce now, close to the event, is more credible than something you reconstruct in 3 weeks. Another pause. Also, Claire, the printout. You kept a copy. I kept a copy of the written statement I submitted to HR. Not the printout. Your own personal copy of the CT images. She hadn't thought about it in the context of what had just happened, because it had been a private thing, something she'd printed for herself, folded, put in her bag the morning of the 14th because she was the kind of person who kept the thing she'd flagged until the case was over, and she was certain the flag had been unnecessary. She'd never taken it out of her bag. It was still there, in the outside pocket, slightly creased from 2 days of existing there, unremarked. She said, Yes. Don't let it out of your possession, Teresa said immediately. And photograph it tonight with your phone. Multiple images, different angles, the timestamp on the hospital's watermark visible. Send the photos to me. The sound of Teresa writing something. I'm going to make a call in the morning to someone I know who handles medical misconduct cases at the state level. Not filing anything, just a conversation. I want to know what the landscape looks like. Claire said, Teresa. Yeah. Thank you. You were right about the vessel, Teresa said. And he took your paperwork to make it look like you weren't. So yeah. A brief silence. Go home. Write it down. She went home. She wrote it down. The morning of the 16th came in gray, clouds sitting low over the plains in the way they did before the Front Range weather changed, the mountains entirely invisible behind a wall of solid overcast. Claire was at the hospital at 7:15, which was earlier than her shift required, but late enough that the administrative wing would be populated and the morning's information would have begun circulating. It had. She learned the shape of the previous night in pieces, the way she'd learned most things at Hargrove, from Priya, from Terrell. In the step-down unit when she walked through to check on Marsh, from the ambient conversation of a floor that was processing something significant and couldn't entirely contain it. What had happened after she'd left the diner was this. Asante had received Priya's call at 9:43 and had immediately contacted Judith Whitmore. Whitmore had called the hospital's head of security and its legal counsel within the same hour. Security had reviewed the chart room footage, the footage that showed Elroy's back, his hands, the motion of removing documents from a file, and had formalized it as an incident report filed with the county sheriff's office at 11:15 p.m. The sheriff's office. Not hospital security, not internal HR. The county. That had been Whitmore's decision, and it was the decision that changed the register of everything that followed, because filing with the county meant the incident was no longer an internal administrative matter that could be managed, reviewed, remediated, and quietly resolved in the language of institutional self-protection. It was now a matter of public record. It existed outside the hospital's ability to contain it, and everyone who understood how these things worked understood exactly what that meant. Claire absorbed all of this while doing her pre-shift check, and then went to find Kwame Asante, who was in his office reviewing images for the morning's first case. A vascular repair on a 70-year-old with peripheral arterial disease, nothing like the Marsh case, thoroughly routine. She knocked on the open door. He looked up. "You talked to Whitmore last night," she said. "I did." He turned slightly in his chair. She was already awake. I don't think she slept much. The sheriff's office filing, that was her call? Hers and legal's together? He looked at her with the expression she'd come to understand as his assessment face. Not cold, but unadorned, the expression of someone who believes in giving people accurate information even when the accurate information is uncomfortable. The filing changes his exposure significantly. Removing documents from a patient's active case file while under administrative suspension after a patient safety event has been flagged for investigation, that's not a workplace dispute. That's potentially obstruction. She said, he probably thought he was protecting himself. Most people who make decisions like that think they're protecting themselves. He turned back to his imaging screen. He wasn't. He was handing the investigation exactly what it needed to establish intent. She stood in the doorway for a moment. How are the other 5 cases? The pattern the QA team found. Asante was quiet for a moment. I've been asked not to discuss the specifics outside the review process, but I can tell you that the QA team worked through the night and that what they found is not going to look better with additional review. He looked at her again. You should prepare for the investigation to move faster than these things usually move. She nodded. She went back to the surgical floor. Gerald Marsh was eating breakfast when she came through the step-down unit at 8:30, actual solid food, which was a clinical milestone that nobody announced dramatically, but that everyone on the floor registered because it meant the body was doing the thing they needed it to do. His wife was in the chair again, this time with coffee and a paperback she wasn't reading. His color was better, the gray less pronounced, the particular flatness of blood loss pallor beginning to give way to something that had more life in it. He looked up when she came in. He was sharper this morning, the cognitive edge of someone whose brain had reclaimed itself from the fog of surgery and blood loss and narcotics. He tracked her differently than he'd tracked her the day before, with more attention, and when she asked how he was sleeping, he said, "Better than I should be, I think," in the tone of a man who understood that the answer should probably be worse. His wife, her name was Doreen, Claire had learned from Terrell, looked at Claire the way she'd looked at her the previous day, with the exhausted intensity of someone who has been frightened for a long time and is still not entirely certain the frightening is over. "They told us there's an investigation," Doreen said, "into what happened." "Yes," Claire said. "There is." "Into the doctor." It wasn't quite a question. "Into the events in the operating room," Claire said carefully. I can't give you details about where the investigation stands, but Mr. Marsh's care team can tell you about his recovery and what to expect, and that part is straightforward. Doreen looked at her hands. He almost didn't come home, she said. The sentence was very simple, the kind of simple that things are when they've been reduced to their essential weight. I was in the waiting room and someone came out and said there had been a complication and I was in that room for 2 hours not knowing. Claire didn't answer immediately. She had learned over years that certain things people said didn't require a response so much as they required the space to be fully said. She waited. I want to know who made it right, Doreen said. She looked up at Claire directly. Not officially. I want to know who actually stayed. Claire said, several people did. The vascular surgeon, the anesthesiologist, the nurses. It was a team. Doreen held her gaze. You know what I'm asking. She did. She said, I stayed. Marsh, who had been listening without appearing to listen, in the way people do when they're not yet fully well enough to carry a conversation, but are alert enough to take in everything around them, said, without looking up from his breakfast tray, That's her. That's who I was telling you about. Doreen looked at Claire for another moment, then she said, Thank you, in a voice that didn't have performance in it, which was the kind of thank you that was actually hard to receive, harder than the kind that comes with context and explanation and the social scaffolding that makes gratitude manageable. Claire said you're welcome and meant it, and went back to the surgical floor. The investigation, as Asante had predicted, moved faster than these things usually moved. By mid-morning, the hospital board had convened an emergency session. Claire knew this not from official communication, but from the particular quality of the administrative wing's activity. The way foot traffic in the carpeted hallway above had increased in a pattern that reached the surgical floor as vibration, as inference, as the collective awareness that something was happening in rooms she didn't have access to. Whitmore was not visible on the clinical floors all morning. The legal team's representative, the man with the laptop from yesterday's conference room, was seen twice in the OR scheduling office pulling paper files. Preston Yates found Claire in the scrub room at 11:15. He came in while she was prepping for the second case of the morning, a hernia repair, uncomplicated, assigned to Dr. Lindqvist, who was exactly as competent as advertised and entirely unlike the problem Hargrove was currently managing. And he stood inside the door with the expression of someone who has been working up to something for 36 hours. He said, I need to tell you something. She kept her hands under the water. Okay. In the OR, when you came around the table. He stopped, started again. I saw what Elroy did before you got there. When the field went red, he stopped. He actually stopped moving for almost 20 seconds. I was doing compressions, and I could see him, and his hands were he wasn't working. He was just standing there. The water ran over her hands. She let him say it. I didn't put that in my original account because I didn't know if I'd seen it right, or if I was going to say something that would. He stopped again. I was 29 years old, she estimated, and in his second year of a residency program that Marcus Elroy had significant influence over. The math of what it had cost him to stay quiet about it was not complicated. I'm going to put it in a supplemental statement today. She turned off the water. She pulled 2 paper towels from the dispenser, dried her hands. She looked at Preston Yates and thought about what she actually wanted to say, and whether what she wanted to say was the same as what would be useful. She said, You should do that. I know I should have done it yesterday. Yes, she said. But you're doing it now. He nodded. He looked like he wanted her to say something else, something that would make the gap between yesterday and now smaller, and she understood that desire, and she didn't have anything for it that would be honest. She picked up her sterile gown and went into the OR. But the supplemental statement existed by 1:15. She found out from Amara Osei, who had been in a meeting with the QA team all morning and came out of it with the stunned look of someone who has spent 4 hours in a room where the full shape of something became clear all at once. Amara found Claire in the break room between cases, sat down across from her, and said without preamble, They found 3 prior cases where he was warned about something in pre-op imaging and documented that he'd reviewed it when he hadn't. Claire set down her coffee. Documented a review that didn't happen. The timestamps on his imaging access logs don't match when he claimed to have reviewed. In 2 of the cases, he logged in after the surgery, not before. Amara's voice was flat in the way voices go flat when they're managing something significant. One of those patients had a post-op complication that was attributed to anatomical variation. She had a prolonged hospitalization. She's fine now, but was she warned about anything in pre-op? Claire said. Amara looked at her. The scrub nurse on that case submitted a verbal concern to the charge nurse the morning of surgery. It was documented in the charge nurse's notes. It wasn't in the operative report. The break room was quiet around them. Down the hall, the floor's normal sounds continued. Monitors, phone calls, the intercom system doing its work. And inside all that normalcy, this information sat like something dense and cold. When was that case? Claire said. 14 months ago. She thought about 14 months, about what had been happening in that OR in the 14 months before Gerald Marsh, and what hadn't been caught, and why. She thought about the scrub nurse who had submitted a verbal concern to a charge nurse, and had it documented and had watched it go nowhere. She thought about the version of herself that could have been in that situation 14 months ago, or 20 months ago, or 2 days ago, if the outcome had been different. Amara said, "I'm sorry I didn't say more in the room." Claire looked at her. Amara was a third-year resident who had spent years building the professional record that would carry her through the rest of her career, inside a hierarchy that punished people for speaking about the people above them in it. The fact that she'd submitted anything at all required its own kind of accounting. "You submitted a statement," Claire said, "voluntarily." "It took me too long." "It took you the time it took," Claire said. "That's what happened." Amara was quiet for a moment. Then she said, "What do you think is going to happen to him?" Claire thought about Elroy in the chart room, back to the camera, hands moving through the Marsh file. She thought about the folder he'd been holding in his office, and the legal team he'd referenced, and the way he'd tried to frame what had happened as a protocol breach that was hers, rather than a catastrophic failure of judgment that was his. She thought about the server logs that existed, whether he had the printout or not, and about Preston Yates's supplemental statement, and about 14 months of cases that were now being pulled and reviewed, and about the sheriff's office incident report that was sitting in a county record system outside the hospital's control. She said, "I think the investigation will find what it finds." Amara looked at her. "That's not what I asked." "No," Claire said, "it's not." She picked up her coffee. "I think he made a series of decisions that were each made worse by the previous one, and I think the documentation of that sequence is now in enough places that he can't manage it. And I think the board is in that meeting right now understanding exactly what the liability profile looks like when a physician ignores 6 warnings and then attempts to remove evidence." She drank the last of her coffee. "So I think it's going to be bad for him. And I think it should be." She was called to Whitmore's office at 3:47. The office was different from the conference room, smaller, with actual personal objects in it, a plant on the windowsill that needed water, a framed photograph on the desk that was turned at an angle where Claire couldn't see it. Whitmore was at her desk, and she looked like someone who had been awake since before this morning's clouds came in. Her reading glasses were on her face this time instead of pushed up on her forehead. She said, "Sit down, please." Claire sat. "The board concluded its emergency session an hour ago. I can tell you what was decided in terms that directly affect you and your position here. And I can tell you what was decided in terms that will become public record through the formal investigation process." She folded her hands on the desk. "In terms that directly affect you, your administrative leave is formally rescinded with a notation in your HR file that it was improperly issued. Your personnel record is being updated to reflect your full military service history, as provided by Army Medical Command, which was transmitted to HR this morning at my request." She paused. "That should have been in your file from the day you were hired." "Yes," Claire said. "It should have." Whitmore accepted that without deflecting. "In terms of what will become public, the board has voted to suspend Dr. Elroy's surgical privileges effective immediately, pending the outcome of a formal surgical performance review that will encompass his case history at this institution for the past 3 years. That review is being conducted with external oversight. We've engaged an independent body, not an internal committee, which was the board's decision and the correct one." She paused again. "The matter of the chart room will be handled through the county process, and I can't speak to where that goes." "Okay," Claire said. "I also want to tell you something that's not official," Whitmore said. Her voice changed slightly, not the register of the chief of medicine, but something that sat adjacent to it, a person rather than a title. When I watched that OR footage last night, all of it, from the beginning, I spent about 10 minutes on your pre-op exchange with Elroy at the nursing station. She looked at Claire directly. You handed him the printout, and he handed it back, and you said, "I hope I'm wrong." And then you stood there for about 15 seconds before you went back to your prep. She paused. I've been doing this for 30 years. I know what that 15 seconds looks like. Claire didn't say anything. I'm sorry it took a crisis for this institution to know who you are, Whitmore said. The plant on the windowsill needed water. The photograph on the desk was angled away. Outside the window, the clouds were beginning to break at the edges, a thin line of late afternoon light coming through the gap to the southwest. The first suggestion that the mountains were still there even when you couldn't see them. Claire said, "Is that everything?" Almost. Whitmore picked up a single sheet from her desk and held it. Dr. Asante has requested that you be assigned to his service on a permanent basis. He submitted the request this morning. It comes with a reclassification. She set the paper down. I'd like you to take a few days before you give me an answer, and I want to be clear that whatever you decide, this office will be providing a formal letter of support for whatever path you take next. A brief pause. Including if that path takes you back to the Army in some capacity. Claire looked at her. You know about Maris's conversation. Colonel Maris contacted this office this morning, as a professional courtesy. There was the faint indication of something that might have been a smile on Whitmore's face. She's thorough. Yes, Claire said. She is. She left the office at 4:05 and stood in the carpeted hallway where the light was soft and the ambient noise was low, and she stood there long enough to take one full breath and let it out completely, which was something she did infrequently and with intention, and then she walked toward the elevator. She was 10 feet from it when her phone buzzed. A text from a number she didn't recognize, Colorado area code, but not one she'd seen before. She opened it. It was a photograph. Taken indoors, at night, poor lighting, the image slightly blurred in the way phone photos go blurry when the subject is moving. It showed a man at a desk, paper spread in front of him. The man's face was partially visible. It was Elroy. And the paper spread in front of him, she could see them clearly enough, the image wasn't that blurred, were not the Marsh file documents he'd taken from the chart room. They were different, older looking, multiple folders spread across what looked like a home desk rather than an office surface. The text below the photograph read, "There's more than one file he took home. I think he's been doing this for a while. I don't know who to send this to. I'm a night custodian. I clean his office. I found the copies 3 weeks ago, but I didn't know what they were. After last night, I thought someone should know." Claire stood in the hallway with her phone and looked at the photograph and then looked at the wall opposite and processed what she was looking at in the quick, functional way she processed things that required immediate decisions. The custodian had a photograph. The photograph showed a man who was currently under administrative suspension sitting at what appeared to be a home desk with multiple patient files spread in front of him. And if there were copies, if he had been making copies and taking them home, not just the Marsh file, but others, the prior 5 cases and possibly more, then what had happened in the chart room 2 nights ago was not a panicked single act by a man trying to control one damaging document. It was the tail end of a longer pattern that had been running quietly for months. She called Teresa first, then she called Asante. Then she stood in the hallway for another moment, looking at the photograph on her phone, and she thought about the 5 prior cases and the scrub nurse 14 months ago who had documented a verbal concern that went nowhere, and she thought about how long something can run if nobody looks at the whole sequence at once. She forwarded the photograph to Teresa with a message that said, "This just came in. Unknown sender, custodial staff. What do we do with it?" Teresa's reply came back in 40 seconds. "Forward it to Whitmore's office right now, then call me." She turned around and walked back toward the administrative wing, phone in hand, and the light through the western windows was doing what Colorado late afternoon light does when the clouds break, going gold and specific, laying itself across the floor in long rectangles, making the ordinary institutional carpet look briefly like something that had been lit on purpose. She knocked on Whitmore's door. Whitmore looked up from her desk. Claire said, "I need another 5 minutes." Whitmore put down her pen. And 2 miles east of the hospital, on a residential street in the flat grid of Cedar Hollow, where the houses sat close together and the streetlights had been coming on earlier since daylight saving time, Marcus Elroy sat at his home desk with the files spread in front of him and his phone in his hand, looking at his own legal team's last message, trying to determine which version of the next 12 hours he was in, the one he could still manage, or the one that had already gotten away from him. And the answer to that question, though he didn't know it yet, had been settled approximately 25 minutes ago in the carpeted hallway of his own hospital's administrative wing, when a scrub nurse with a photograph on her phone turned around and walked back the way she'd come. Whitmore looked at the photograph for a long time without speaking. She looked at it the way she'd looked at Colonel Maris's 2 pages of documentation in the conference room, not performing reaction, just reading, the same way she'd apparently watched OR footage until 8 o'clock on a Tuesday night, with the particular quality of attention that belonged to someone who understood that what she was seeing would determine what she did next, and therefore deserved to be seen accurately. Then she said, "Sit down." Claire sat. Whitmore picked up her desk phone and made a call that lasted 40 seconds, during which she said 3 things. That she needed the hospital's legal counsel in her office in 10 minutes, that she needed the head of security to preserve all physical access logs for the administrative and chart storage areas going back 90 days, and that nobody was to contact Dr. Elroy through any official hospital channel until she said otherwise. She said all 3 things in the same unhurried tone she used for everything, and then she put the phone down and looked at Claire. "The sender," she said. "Did they identify themselves beyond custodial staff?" "No. Unknown number." "Are they still reachable at that number?" "I don't know." Claire looked at her phone. She typed a reply to the unknown number. "Thank you for sending this. Can you tell me your name? You're not in trouble. This helps." She showed the screen to Whitmore before she sent it. Whitmore nodded. She sent it. 3 minutes passed. The legal counsel arrived, the same man with the laptop, whose name Claire had learned was Barrett, and Whitmore showed him the photograph on Claire's phone without explaining it first, letting him read what it was before she framed it. It was a good instinct. Barrett looked at it for 5 seconds and then said, "We need the original file. Can it be transmitted?" Claire forwarded the photograph to Barrett's email from her phone while he watched. He opened it on his laptop, enlarged it, studied the files visible on the desk in the image. He said, "I can make out at least 2 different patient folders. The coloring on the tabs is from our old filing system, pre-2023. He looked at Whitmore. "If he's had these at home, if these predate what happened Monday, then this isn't reactive," Whitmore said. "This is habitual." The word sat in the room without anyone adding to it. Claire's phone buzzed. The unknown number again. The reply read, "My name is Otis Reeves. I clean the surgical wing nights. I found copies in his office trash 3 weeks ago. Shredded, but not fully. I taped some back together because something felt wrong. I have the originals. I didn't know what to do with them." She read it aloud. Barrett was already typing. Whitmore said, "Mr. Reeves needs to speak with our legal team tonight. Can you ask him to come in?" Claire typed the message. The reply came back in under a minute. "I can be there in an hour." Otis Reeves was 58 years old, had worked the night custodial shift at Hargrove for 11 years, and arrived at the administrative entrance at 5:50 in his civilian clothes with a manila envelope held against his chest with both arms, the way people hold things they've been carrying alone for too long and are only now allowing someone else to see. He was a large man with a careful way of moving, and the expression of someone who had spent the drive over rehearsing what he was going to say and was now discovering that the room looked different from how he'd imagined it. Whitmore met him personally in the lobby. That was her choice, and it was the right one. Not sending an assistant, not routing him through reception, but walking down herself and shaking his hand and saying, "Mr. Reeves, thank you for coming. What you did took courage." She said it without flourish, which made it land more accurately than if she'd dressed it up. He sat in the conference room with Barrett and a second attorney who had been called in, and Claire waited in the hallway because she'd done what she needed to do and the rest of it was not hers to manage. She sat in one of the chairs along the wall and looked at the carpet and thought about Elroy at his home desk 2 miles east of here, looking at his phone, running his calculation. The calculation was wrong. It had been wrong since the moment he'd walked into the chart room with his back to the camera, but it had been wrong before that too, in ways that had been accumulating for 19 months across 6 cases and a pattern of document access that the server logs were going to show with the kind of specificity that made arguments difficult. A man who has spent years being the most important person in every room. He enters, develops a particular blind spot about what rooms look like when he's not in them, what persists after he leaves, what gets documented, what other people notice and remember and eventually write down. Priya came and sat next to her at some point. She didn't say anything. She just sat there with her own cup of coffee, and Claire appreciated the company in the way you appreciate things that don't require explanation. After a while, Priya said, "Otis has been here longer than anyone. 11 years. "I know," Claire said. "He's he's there. Nights, cleaning. Nobody really—" She stopped. Nobody paid much attention. Claire looked at the conference room door. "People who do the work other people don't notice tend to notice everything," she said. Priya thought about that. "Yeah," she said quietly. "They do." The county sheriff's office executed a voluntary evidence preservation request at Elroy's residence at 9:17 that evening. Not a search, not an arrest, a request, which his attorney advised him to comply with. And he did, which told everyone who understood these things what they needed to know about where his legal team assessed his position. The files on his desk were photographed in place before being taken. There were 11 folders. 8 of them contained copies of patient operative records from Hargrove. 3 contained his own handwritten notes on cases, written in the marginal shorthand of someone who had been preparing a private account of events, not to submit to anyone, just to have, in the way people prepare private accounts when they know they are moving toward a reckoning and want to be ready to tell their version of it. The notes didn't help him. Notes taken after the fact, in private, by the subject of an investigation, are only useful if they tell the story you need them to tell. His didn't. They told the story of a man who knew he had ignored warnings and was working backward to explain why the ignoring had been reasonable, and the problem with that story was that it ran directly contrary to every other piece of documentation that now existed in 3 separate institutional systems. Teresa called Claire at 10:40 to tell her what had been transmitted to the state medical board. She went through it efficiently, the way she went through everything, the operative records, the server access logs establishing the false documentation of pre-op imaging reviews, Yates's supplemental statement about the 20 seconds of paralysis in the OR, Amara Osei's account, Asante's clinical notes, the intraoperative footage, the chart room security footage, the photograph from Otis Reeves, and the contents of the 11 folders. "The board is convening an emergency review," Teresa said. "Given the documentation volume and the number of patients involved, they're not going to move slowly on this." Claire said, "What does that mean for his license?" "In the short term, emergency suspension of surgical privileges statewide. That's already done through the hospital, but the board will formalize it at their level. In the longer term, I think you're looking at revocation. The false documentation alone is enough. The chart room incident on top of it, with the sheriff's report, adds criminal exposure." A pause. "His attorney is going to try to negotiate something. They always do. But the documentation is extensive enough that negotiation has a ceiling." Claire sat with that information. She thought about what revocation meant in practical terms, not as punishment, though it was that, but as outcome. Marcus Elroy would not operate again. Not at Hargrove, not anywhere in this state. And given that state medical board actions were reportable to the National Practitioner Databank, not anywhere that checked the databank, which was everywhere that mattered. She said, "What about the patients, the 5 prior cases?" "The board will notify them. There's a process for that." Teresa's voice was careful. "Some of them may have claims. That's a separate process and it's going to take time, but it will happen." "The nurse," Claire said, "the one who submitted the verbal concern 14 months ago." "I know who you mean. I'm going to call her." A pause. "Not officially, just to let her know that what she said was documented and that it's part of the record now. That it mattered." Claire didn't say anything for a moment. She thought about a scrub nurse 14 months ago submitting a verbal concern to a charge nurse and watching it go nowhere, and going home, and coming back the next shift, and doing the work. The invisible accumulation of that. How long you could do it before the weight of being ignored became something that reshaped you. She said, "Thank you, Teresa." "Get some sleep," Teresa said. "Tomorrow is the official part." Tomorrow was, in fact, the official part, and it was longer and more institutional and less cinematic than anything that had preceded it. Meetings, documentation, formal statements, the careful procedural language of institutions, covering ground that human beings have already crossed, but that the institution needs to cross again in its own way, at its own pace, for its own records. What Claire remembered most clearly from that day was not the meeting with the board's external reviewer, or the formal reinstatement documentation Whitmore signed in her presence, or even the call from the state board confirming the emergency suspension. What she remembered was a moment in the afternoon when she was walking back through the step-down unit to check on Gerald Marsh, and she passed the room of an elderly woman named Patricia who had been recovering from a hip replacement for 4 days, and who called out to her as she passed. Claire stopped, looked in. Patricia was small and white-haired and had the sharp, watchful eyes of someone whose body had gotten old but whose mind hadn't agreed to follow. "You're the one, aren't you?" Patricia said. Not a question. "I work here," Claire said. "That's not what I asked." Patricia had her television on, volume low, the local news running. They said something on the news about the surgeon and a nurse. She looked at Claire with the watchful eyes. "Are you her?" The local news. Claire hadn't thought about that vector. She thought about it now, briefly, and then she thought about this woman in this bed asking her a direct question. "Yes," she said. Patricia nodded slowly. "Good," she said. "Somebody should have. A long time before now, probably." She picked up her television remote. "You go ahead, honey. You've got things to do." Claire went ahead. Gerald Marsh was discharged on the morning of the 19th, 5 days after surgery, which was 2 days longer than a routine laparoscopic cholecystectomy would have required, but 2 days shorter than the worst-case projections from the night of the arrest. He walked out of the step-down unit under his own power, which was the benchmark they'd been working toward, and Doreen walked beside him with her hand through his arm in the way people walk with someone they have recently come close to losing and are not yet taking for granted again. Claire was at the nursing station when they came through. She wasn't waiting for them. She had a pre-op checklist in front of her for the first case of the morning, and she was working through it. But she looked up when she heard them, and Marsh stopped when he saw her. He looked better than he'd looked in the step-down room. The gray was gone. He was still moving carefully, the deliberate pace of someone whose body was reminding him with every step that it had been through something, but he was upright, and his eyes were clear, and he was wearing the jacket he'd presumably arrived in 5 days ago before any of this had happened to him. He said, "I heard about what happened, the investigation, the other patients." She said, "Yes. I want you to know—" He stopped. He had the look of a man who has been composing sentences in his head for days and is discovering that they don't quite hold their shape when spoken out loud. "You didn't just save my life. The way it sounds, the way it went, you saved the next person too, and the one after that." She thought about what to say. She thought about Patricia in room 6 saying somebody should have, a long time before now. She thought about the scrub nurse 14 months ago, the verbal concern documented in the charge nurse notes, the fact that patterns require individuals to disrupt them, and individuals do not always have the resources or the position or the protection to do that disrupting, and that this was the ordinary tragedy of institutions, which move slowly and protect themselves and only change when the cost of not changing becomes higher than the cost of changing. She said, "I hope the people before you get what they need too." He nodded. Doreen was watching Claire with the expression she'd had in the step-down room, not exhausted anymore, but something else, the particular look of a person who is trying to memorize a face. Marsh put out his hand. She shook it. His grip was stronger than she'd expected for a man 5 days out from surgical arrest, and she registered that as its own kind of good sign. "Thank you," he said, "for not staying in your lane." She almost smiled. "Take care of yourself, Mr. Marsh." He walked toward the elevator with his wife, slowly, carefully, one step at a time, alive. The formal board hearing on Elroy's case was held 12 days later. Claire was not required to attend. Her documentation had been submitted, her statement was in the record, and the board's process did not require her physical presence for its machinery to run. But she went, because there are things you attend not because you are required to, but because they are the conclusion of something you began and you want to be present when it ends. The hearing was held in a state administrative building in Denver, a low-ceilinged room with fluorescent lighting and plastic chairs, and the specific bureaucratic atmosphere of a place where significant things are decided in undramatic settings, which is where most significant things are actually decided. Asante was there. Amara Osei was there. A woman Claire didn't recognize sat near the back, mid-40s, quiet, who turned out to be the scrub nurse from 14 months ago, who had driven 2 hours to be in this room and sat through the entire proceeding without saying a word to anyone. Elroy was present with his attorney. He had aged, visibly, in the 12 days since the chart room. The particular aging that comes not from time, but from sustained pressure, from the specific exhaustion of maintaining a version of events that reality keeps contradicting. He wore a suit and a careful expression, and he did not look at Claire when she came in, which told her something about which version of himself he was still trying to occupy. The board's findings, when they were read, were specific and complete. False documentation of pre-op imaging review in 3 cases. Failure to implement adequate safety precautions in 6 intraoperative events over 19 months. Removal of patient records from a clinical facility while under suspension, in violation of HIPAA and state medical records law, which had been referred to the county prosecutor's office as a separate matter. Conduct unbecoming a licensed medical professional in the intraoperative management of the Marsh case, including failure to respond adequately to a reported patient safety emergency. The board voted unanimously to revoke Marcus Elroy's medical license. The attorney asked for a 30-day stay to prepare an appeal. The board denied it. Elroy stood when the decision was read. He stood very straight, the posture of someone whose body has defaulted to its professional bearing because the professional bearing is all that's left when everything else has been stripped away. He looked at the board. He did not look at the room. His attorney said something to him quietly, and he nodded once, and then he gathered his papers and walked out, and the sound of his footsteps on the institutional floor was very ordinary for a sound that was marking the end of something. Claire watched him go. She had expected to feel more, or differently, than she felt. What she felt was something quieter than satisfaction and more durable, the specific weight of a thing that has been correctly resolved, which is not the same as happy and not the same as relieved, but is its own form of right. Asante, sitting 2 seats to her left, said under his breath, "It should have been sooner." "Yes," she said. "It wasn't, but it happened." "Yes," she said again. "It did." The scrub nurse from 14 months ago was standing in the parking structure when Claire came out. She was next to a blue sedan, keys in hand, not quite leaving. When she saw Claire, she stood still in the particular way of someone who has been deciding whether to say something. Claire walked toward her. She stopped a few feet away. The woman said, "My name is Diane Pruitt. I was the scrub nurse on the Holloway case 14 months ago." She had a direct way of speaking that Claire recognized as the register of someone who has been holding something in professional silence for a long time and has finally run out of reason to. "I submitted the concern to the charge nurse. They told me it had been noted. I never heard anything after that." "I know," Claire said. "Teresa Kowalski, the attorney, she's going to reach out to you for the civil side of it. The Holloway family has a case." Diane nodded. She looked down at her keys. "I kept coming back to work," she said, "every shift. I kept thinking, did I say enough? Did I say it right? Did I say it loudly enough?" She looked up. "I said it. I said exactly what I saw, and nothing happened." "I know," Claire said. "And then it happened to you, and something happened." She held Diane's gaze. She wanted to say something that was true, not something that was comforting in the way that comfort flattens things into a shape easier to carry. "The difference wasn't what you said or how you said it," Claire said carefully. "The difference was the sequence of things that happened afterward, and the people who were in the room, and a dozen factors that had nothing to do with whether you were right." She paused. "You were right. The record shows you were right. That's what you get to take from this, even if it came too late to feel clean." Diane looked at her for a long moment. Her expression was the complicated expression of someone receiving an accurate thing they don't entirely know what to do with. Then she said, "How do you keep going back?" Claire thought about the honest answer. She thought about the pre-op conversation and the printout and the 15 seconds at the scrub sink and the 8 seconds in the dark red field. She thought about all the times she had said what she saw and been handed it back and gone back to her instruments and stayed ready, because staying ready was the only posture that made sense when you couldn't control what other people did with the information you gave them. She said, "Because the next patient is coming regardless, and I'd rather be there when they do." Diane was quiet for a moment. Then she nodded. Not the nod of agreement exactly, but the nod of someone who recognizes something true even when it doesn't make everything easier. She got in her car. Claire watched her pull out of the parking structure and into the Denver afternoon. And then she walked to her own car, and she sat in it for a moment with her hands in her lap before she started it. 3 weeks later, on a Tuesday morning that came in clear and cold, with the mountains fully visible in the way they only are. When the air is perfectly clean, Claire arrived at Fort Carson at 7:45 for her meeting with Colonel Maris and the program director of the Army Medical Command's Forward Surgical Training Division. She wore civilian clothes. She had her service record in a folder she'd printed the night before, though Maris had told her she didn't need to bring it. She brought it anyway. The program director was a woman named Major Hollenbeck, early 40s, with the focused efficiency of someone who had spent years identifying gaps between what training programs taught and what the field actually required, and who had a long and detailed list of questions prepared and did not apologize for working through all of them. The meeting lasted 3 hours and 40 minutes and went places Claire hadn't expected, into the specific mechanics of tactile spatial orientation in degraded visual fields, into the cognitive load differences between anticipatory and reactive operative decision-making, into what training environments had to replicate and what they couldn't, and what you did about the gap between those two things. At one point, Maris said, "What's the single thing that current surgical training gets most wrong about high-pressure operative response?" Claire thought about it. She thought about Gerald Marsh's field going red and the 20 seconds Elroy had stood still. She thought about every training environment she'd ever been in, the way they replicated stress up to a threshold and then built in a safety mechanism that removed the stress once the threshold was crossed. Because removing the stress was the humane thing to do, and also the thing that prevented trainees from learning what happened to decision-making when the stress did not remove itself. She said, "It teaches people what to do when everything is failing. It doesn't teach them who to be when everything is failing. Those are different problems." Hollenbeck wrote something down. Maris looked at her with the small, precise expression that meant she was satisfied with an answer. She took the position. Hargrove Regional threw her a small, unofficial, moderately chaotic gathering in the break room on her last shift, organized by Priya and Terrell, and attended by approximately 20 people, most of whom brought food that was thematically unrelated to anything and talked over each other in the way break room gatherings do when they're real rather than performed. Asante came for 20 minutes and said almost nothing and ate most of a sandwich and shook her hand when he left, which was entirely consistent with who he was. Otis Reeves was there. He came in at the end of his shift with his custodial cart still in the hallway, wearing his work clothes, and stood near the door in the way of a man who isn't sure he's been invited to the center of things. Priya went and got him and brought him fully into the room and put a plate of something in his hand, and he stood there looking slightly overwhelmed and eating his food, and Claire went over and stood next to him for a while. He said, "I almost didn't send that picture." "I know," she said. "I kept thinking, I'm just the night guy. Nobody's going to—" He stopped. "Nobody listens to the night guy." She looked at him. 58 years old, 11 years on this floor, watching everything from the periphery of a place that had never thought to ask him what he saw. "You're the reason it's over," she said. "You specifically. Because you noticed something wrong and you kept the evidence and you found someone to send it to." She paused. "That's not nothing. That's the whole thing, actually." He nodded slowly. He didn't argue with it. He just nodded, and she thought about all the people in institutions who do the work. Nobody documents, who notice the things nobody catalogs, who carry information in silence, because the channels for transmitting it don't run in their direction. She thought about what changed and what didn't, and what needed to be different, and she thought that building something different, in a training room at Fort Carson, in the hands of surgeons who would operate in the dark and need to know who they were when everything failed, was exactly the right place to put what she had. She left Hargrove at the end of that shift the same way she'd arrived every shift for 2 years and 4 months, out the side entrance, down the stairs, through the lot to her car. Ordinary. Unremarkable. The building looked the same from the parking lot as it always had, except that as she reached her car, she heard it, a sound behind her, and she turned. There were 6 of them. Young nurses, 3 she recognized from the surgical floor, 2 from step-down, 1 she'd seen in the ER but didn't know by name. They were standing in a loose line near the side entrance, in their scrubs, End of shift or beginning of one? It was hard to tell. They looked at her. And then, without a word between them, without anyone prompting or directing it, they came to attention. Not military attention. None of them had that training. It was something else, something that didn't have a name in any regulation. The posture of people who have decided that the moment requires something more deliberate than standing normally. They stood straight. They looked at her. Claire stood by her car and looked back at them. She didn't salute. She didn't perform anything. She just looked at them for a moment with the full attention that they had earned by being in a building where hard things happened and coming back the next shift anyway. The invisible currency of people who stayed when staying was costly, who spoke when speaking was risky, who held on in the dark when the field had gone red and there was no clear view and no guarantee. She nodded once. They nodded back. She got in her car and drove. There are institutions that protect people and institutions that protect themselves. And the difference between them is not a mission statement or a set of values printed on a wall. The difference is what happens when someone in a hallway or a pre-op bay or a scrub room says, "I see something wrong," and the people above them have to decide whether that person is a problem to be managed or a signal to be heard. Marcus Elroy lost his license because he could not hear the difference between authority and competence. And he had spent so long mistaking one for the other that when they finally separated, in a red field on a Monday morning, with a patient flatlining and his hands uncertain, he had nothing left to stand on. Claire Navarro kept her hands steady, not because she was exceptional, but because she had been in the dark before, and had learned repetitively, and at cost, that the only way through a field you can't see is to stay present and move from what you know. That's not a gift. That's a practice. It's available to anyone willing to do the thing that quiet competence always requires, which is to speak the true thing and then remain ready for what comes after, regardless of whether anyone is listening. The patient walked out alive. The night custodian sent the photograph. The resident submitted the supplemental statement. The scrub nurse from 14 months ago drove 2 hours and sat in a chair and let her account become part of the record. None of them were in positions of institutional power. All of them did the thing anyway. That's not an unusual story. It happens in hospitals and schools and offices and every kind of organization where people work, every day, in the ordinary, unglamorous way that things actually change. Someone sees something. Someone says it. Someone, somewhere, finally has the documentation in enough places that the pattern can no longer be managed as a series of individual incidents. The surgeon lost everything because he believed that the room arranged itself around him and would continue to do so regardless of what he did inside it. The nurse earned what came next because she understood that rooms don't arrange themselves. People do, one careful decision at a time, and the decisions compound, and eventually what you have is either a record that holds or a record that doesn't. Hers held.